So this young lady had a facelift 3 weeks ago, and you could just see with her oVio capture, look how beautiful her necklines are. And the way I use this, Jason, is in the office. I show patients how they're gonna look a few weeks after so they know what the swelling looks like.
And it's 360-degree capture, right? In all motion, and you're actually seeing movement. You're not just seeing a static image.
Oh, absolutely. So we're looking at motion as well as having 360 still images. So you've got perfect images that you can use for presentation, but also the motion capture where you can look at motion as well as tissue dynamics.
This is not your typical 3D capture. This is a 3D capture in motion, so taking it to the next level.
Absolutely. And what this shows is how the soft tissues respond to lasers, all the energy devices we use, and also surgery. So the patient gets to see the whole picture.
And we're going to be using this also with some filler injections to see how the fillers actually move in the patient. So it's not just a big blob in their face.
Absolutely.
We can really see what's going on with this technology.
Absolutely, because patients want to know how they're going to look in motion, not just a still capture. So that's where oVio comes in. It's really a great way
and
to
she looks very natural, and you can see from her motion how she moves easily. There's no funny lines, there's no funny wrinkles, and then you can see how the technical aspect of the facelift was done in a way that you didn't create any abnormal lines.
Yes, absolutely. So this is a great patient on oVio. This gentleman had the MyElevate procedure and energy. Look at his results, Jason.
Yeah, beautiful. Natural looking result. In 360, you can watch him move, you can watch him smile, you can watch how the nerves work, and you can see there's no scars anywhere on him. I mean, this is an amazing result and just an amazing way to show the results.
Yeah, and I remember when he came in, he said, I don't want scars behind my ears, I don't want scars anywhere. He never realized how full his neck was until we captured it with oVio.
Mine, when are you doing mine?
Absolutely.
Yeah, this is a home run. You hit a home run with him.
Thank you. And the downward view here on oVio is great because it shows the support we have underneath the jawline. You know, we don't capture these with standard capture, but you can see with oVio, you really see the support there.
Yeah, and I like the in motion looking at the muscles, making sure that all the muscles work beforehand and afterwards, because sometimes the patients have problems beforehand and then you don't notice it until after the surgery. So you can really see how all their muscles are working and how good a result you have.
Absolutely. So another great use of oVio is being able to show patients how they look the next day. So look at this patient one day after the MyElevate procedure.
It's amazing. There's no bruising, and the patients are scared that they're going to look like monsters. They're always asking, what's the recovery? And they don't really believe us when we tell them 1 to 2 days. So this is proof.
Yeah, and you can just see how oVio documents her jawline, shows her really in all angles. She can see how she looks sort of from the back, from the front, as she looks up, looks down.
And you can see the sweep along the jawline you created, made beautiful result.
Absolutely, and you can see a little bit of the swelling under there as well. oVio gives the full picture, so patients really trust it, and that's what I love about it. Because we have this fully documented medical record of her in every dimension, if there's ever anyone who comes in and they have a little asymmetry, they know they had it before, or if you have a little bit of a bruised nerve, you can show them that it's healing.
We all need this in our practice.
Yeah, it's an amazing way to document
This is a game
outcomes.
changer.